Hi, I'm making this video about some COVID statistics. I'm doing so because I'm an ER doctor and I wanted to show how data correlates to proposed public policy and why sometimes this proposed public policy is unreasonable. So I wanted to share a few very highly vaccinated areas in the United States and couple outside of the United States and then correlate their spikes with their vaccination rates. Um, so the first state I wanted to show is Vermont. So Vermont is, let's see, 89%, 90% have at least one dose, and almost 80% are fully vaccinated. Okay, so if vaccines were to stop spread, then we should not see a spike in their COVID cases. However, looking at Vermont, we see that they are spiking harder than they ever were. So the spike isn't in just unvaccinated people, because that is a 90% vaccinated population. So the spike is actually in the vaccinated population. Now with Vermont, it's not a good data point because they don't get many deaths on average, but we do see that vaccinations do decrease mortality and morbidity. They decrease hospitalizations. But what this data shows is they don't really reduce infections or transmission of the virus. So here's Portugal. So they are a highly vaccinated population, right? 90% vaccinated, fully vaccinated, 88.3%. So they shouldn't see a spike if the vaccines are protective from that. And look at their spike, higher than it ever was. So given that they are a 90% vaccinated population, the number of infections is certainly not among the unvaccinated individuals. So vaccinating everybody does not solve this problem. So, but if you look at their deaths, look, they peaked and now they have plateaued. And even because of the highest peak that they had, their deaths have plateaued, and the pandemic is over. Canada, last example, they are approaching 80% vaccinated, fully vaccinated, which is this black line. And then if you look at their cases in Canada, they're spiking. So, but if you look at their deaths, so that's Canada. You look at deaths, also low. They're still having some spikes, but much lower than they were. Now, whether this is because people who were going to die already died or something else, that's, or the vaccines, that's kind of hard to say. Probably the vaccines. And the last thing I wanted to show is deaths by age. So the proposal is that everybody should be vaccinated, and this mandate is hurting a lot of people, and from what I'm hearing, it's making life really difficult, especially in the big cities, because people are excluded from everything. Now, given what I just showed, that all these spikes are among highly vaccinated populations, we know that just by vaccinating people more will not really do anything in regards to transmission. Now, if we also take a look at the available data from age of 0 to 50, the proportion of people who die from COVID is far lower than those in older age groups. So if you are going to target vaccinations, you need to target the vaccinations according to the group that they will help. So if you're going to compel anybody, then you may have to consider just compelling a part of population instead of the whole population. Now, these people in this age group usually suffer from a milder disease unless they are morbidly obese and things of that nature. So they should get vaccinated as well. The healthy ones don't have to. So putting all this pressure on people in order to mandate something that's not really going to achieve, or doesn't have to be as broad, because it's not going to achieve the desired effect. Either way, the spikes are going to happen. You need to vaccinate people who are at risk of severe disease, and that's all you have to do. But unfortunately, our public policy is different. People are freaking out about this, and just as a last mention, that this number is lower than how many people die from opioids every year in this age range. So these people die from drug overdoses at a much higher rate than they do from COVID. but the solution is to emergently vaccinate them for COVID, where their problem is somewhere else. So that's just what I wanted to show. This is why public policy is not based on science. It's based on politics. It's unreasonable, and government is always unreasonable like this, and they are hurting people through their just stubbornness and inability to adapt to ever-changing data. That's it.